All right, Dr. We're live.
Hey guys, it's Dr. Emer, and we're doing a great treatment today, male facial sculpting. One of my favorite treatments, been doing for many years, but now it's becoming really popular, is jawline contouring. We have a similar facial shape, a little bit longer, a little bit less definition at the angle of the jaw, structured in the front, but not as much in the back. So we want to build out that little bit of that 90-degree angle and give him a little bit of a squared or more squared look. So one, it improves the neck, but it also makes his jawline look more defined. We're going to use a filler called Restylane Define today, a hyaluronic acid filler. You guys can see we're going to focus literally right at the 90-degree angle. I want this to pop. So to get this to pop, now I drew this out because I want to show you guys something. If we really were going to go all out, we would use filler all the way down through here to build this sort of foundational area, and then we would focus right at the 90-degree angle to push it out. If we're going to limit ourselves to the number of syringes, we're going to focus right at that 90-degree angle, and we're going to build that area up, okay? So what we're going to do is just do a nice depot here originally, right at that angle of the mandible, this 90-degree angle, because I really want that area to pop for him. And this should not be really painful at all. It's very minimal pain. You guys can see already, take a look, it's already starting to pop. And so I drew this little like 45 degree because this is a technique that helps to sort of make a very natural looking appearance of the masseter. Look up a little bit higher, right there.
How long does this last?
So this will last about a year. But you know, interestingly, for some reason, unless someone's like a big grinder, teeth grinder at night, I've seen it last even longer than that, even though these fillers really shouldn't last as long. So that's just one syringe. I'm going to show you guys in a second the difference. Take a look at that. You can see it already in the 90-degree angle. Okay, so I'm going to just wipe this off a second. Now, some of the things you can do to enhance the jawline besides doing filler is to do like a neck liposuction or heating. Now he's very thin, so his skin is like mine, it's just a little bit of looseness. So at some point, if you ever did like a Renuvion or some tightening, like look at already, his anatomy is perfect. So you can see where we just placed the filler, it's right there. Bite down, so you can see it popping out. Good, sorry about that. Good, so let's go to the other side, we'll let that sit a second. You have one? Yeah. We're gonna do the same thing over there. What are they saying? Look up a little bit.
So is that the same as for lips?
You can use Define in the lips, but it's gonna be a little more thick. I tend to like Kiss or Silk if you want a softer lip, regular Restylane. There's a lot of other options. A lot of people are using Refine lately as for a softer look that has some volume. It's really a preference on look when it comes to the lip. So again, about half the syringe right at that angle to get that built, and then look up again. We're going to use my 45.
What is the pain on a scale of 1 to 10?
Maybe like a 1. Honestly, I can barely feel it.
You're perfect. And he's not saying that. He's not getting paid. This is not an infomercial. Okay, yes, it's filler night, but still. He's done it before, he's back. Turn a little bit this way again. So I'm going to show them again, right at that angle. Let's build that out a little bit more. And the good thing is we have another syringe that we can play with. So let's wipe it down. Let's take a look at what the one syringe has done. Now remember, you guys, let's see straight. Go ahead and bite down a sec. Good. So we got some angle there. Now let's go to the other side. Okay, let me come to the front sec. Look up again. Perfect. So now I'm going to use a little bit more. Let's structure this a little bit more. And with the HA fillers, you guys, you'll see it now, but honestly, it really kicks in after a few weeks. So you'll see it even more in the next couple weeks. But it's going to be pretty awesome even now. And there's different ways to do this. A lot of people always write me in about my technique, and honestly, I created it. I don't know what to say when they ask me. I made it up. So I've been doing it for a long time, and look how perfect that is. Look at that. You can see it and show it from an angle, kind of rotate. You see it?
Mm-hmm.
2 layers on bone and tissue. On both the bone and the tissue. Let me see that side. Oh yeah, that's good. This side is a little more deficient in the bone, so it's gonna be a little harder to make it perfectly even, but it's gonna be better. Look up again. Sorry, it's a weird feeling. We're really building, like, again, at that 90-degree angle, but then we're kind of feathering upward to create more of a square. And this
What do you
side-
recommend for under eye circles?
Well, we just did the video.
Guys, go to our
Go
last
watch.
live. We just did one.
Thank you.
Look up again, a little bit higher, sorry.
Does it melt if we
No,
make facelift massage?
facial massage, no,
Face- No.
not at all. Okay, so now, let's do a reveal. Just look at both sides.
All right, do I give
Ooh,
this?
That's nice.
There you go.
Bite down again, let me see. Great, okay, so let's do Emer reveal first. So we're gonna do a reveal with the
Grab the phone.
I want you to focus on the 90 degree.
Grab
Hold
it.
grab it and hold
Grab
it.
it.
Grab it and hold it up, and then I want you to look at this angle.
Oh, it's so much more defined.
Bite down, it's gonna be hard to see. You don't have a lot of bone structure here, but you'll be able to see it pop out a little bit. And like I was saying, if I was to pull in the skin, let's say I did that, look right where it is. Right here. So it's really built out at the angle. Is that what you wanted?
Exactly what I wanted, yeah.
Perfect, and it's good for your facial shape because you're a longer face, you're leaner. So we really want this built. At some point, you could always take the filler and come all the way down, but that would require a bunch more syringes. So the focus was really on building at the 90 degree.
It's great.
So we did it. So now let's show him in the mirror. I want him to see in the mirror because that's gonna be more visible to him. What do you think?
That looks perfect.
Yeah, it's great. It's good because no one will ever know. This is like your secret, you guys. If you go to if you go out right now, and no one will ever know. If he wanted a little more robust, we could change to a different filler. This will be a little bit softer of an angle. And if we want to do a little bit more, we could just add more in the next couple weeks. Give it a few weeks to settle, and take a look at the final look, and then you decide if you want more. You just keep it that way for 6 to 12 months.
Great.
All right, that's it. Do a little
Awesome.
pan to the group and let them go. Good job. Let me see. Oh, that's really good there. Awesome.
All right.
All right. Nice.
Looks so good. Oh my gosh.